Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. This is Valley Health Minutes. Today we're talking about something that is not fun to live with, but happens to so many women. We are talking about urinary incontinence and prolapse and what help is available to women. So we have Dr. Caleb Huff with us today talking about this. What would you want to get across to women for the most important part?
I would say that this is a major issue that affects millions of women across the country, and it is just very underdiagnosed and undertreated. And I just want everybody to know that there is treatments and cures for this.
So you don't just have to live with it.
Right.
Is it just part of aging and having children that sometimes our bodies don't do what we want them to do anymore?
Right, so it's common, but it's not normal. So that's another point I want to get across. Just because you've had children, or your mother had this issue, or your grandmother, doesn't mean that you have to live with this. This is something that we can work with.
Okay, so let's talk about what this is. What do the problems look like that people could say, there's hope for me?
So any type of urinary incontinence, leaking, especially when you cough, sneeze, laugh, lift, the famous test is the trampoline test. So, I hear women say, I can't jump on a trampoline with my grandkids or with my kids. And that's like the ultimate test. So I do a surgical procedure called the bladder sling. It takes about 15 minutes. It's an outpatient procedure.
Outpatient procedure, not in the hospital overnight.
Right. And it's 95% effective, and it starts working right away.
Okay. Are there any concerns or anything that people should be aware of that maybe a bladder sling wouldn't be for them?
If they have what's called urge incontinence, that's when you sometimes see the commercials for the gotta run to the bathroom. So when you get that sudden urge to go to the bathroom and you can't quite make it before you leak, that is treated with medicines, but we can also work with that as well and minimize those symptoms.
So the bladder sling is more for stress incontinence,
Exactly.
when you're running or jumping or chasing your kids.
Right.
Because that's not a lot of fun to go through that. What are some of the benefits of having these procedures?
Well, resolution of your symptoms. I mean, I've had so many patients that are almost homebound because they're either embarrassed of their incontinence, worried about leaking in public. They keep a change of clothes with them. They wear pads all the time, incontinence pads, and those are expensive over time. And they stop doing social events, stop going to church, stop seeing friends, and it just makes a huge impact on their life. And then if you can fix that, you can get them back out into the world and enjoy their life again.
Yeah. So how do you bring this up with your doctor? I mean, it's kind of an embarrassing subject.
It is, yeah, it's embarrassing, but I just ask all my patients, and typically, say, do you leak when you cough, sneeze, laugh? Oh yeah, well, does it bother you?
Isn't that funny? Doesn't everybody?
Right. And look, well, does it bother you? Well, yes, it does. Well, how about we do something to fix that? So I think bringing that up to your doctor is important as a concern that you have that you want to be addressed.
So let's talk more specifically about the procedure. How does it work? You said outpatient. What's your downtime? What's your recovery like?
So, like I said, it takes about 15 minutes for me to do. While you're in the hospital, we want to make sure that you can empty your bladder completely before sending you home, so that you don't have, you don't go home and have a full bladder and can't empty. Downtime is very little. It's an incision about that big, about an inch, and nobody sees that incision. And I would want to have some lifting restrictions for a couple of weeks, and probably take the weekend off, and you're back to work on Monday.
And get the help that you need.
Right.
And that could possibly change your quality of life. Very interesting. What else should people know about this? How about insurance coverage? Do a lot of insurances pay for it?
Insurance cover this. We've had no issues with insurance coverage because it's first line treatment for stress incontinence is surgery. So we've had really good results from that.
Okay, very interesting. Well, a lot of great information. Any final thoughts?
Also about the prolapse, a lot of times we hear women describe it as like a dropped bladder. which can mean a lot of different things, but it's a bulge sensation that you may feel. That can be a bladder drop, it can be a rectum bulge, or the uterus coming down, and that can be a lot of different symptoms, such as like pelvic pressure, tugging, pulling sensation. That's also something that we can work with and correct surgically.
So there's help out there. You don't have to just live with it.
Right.
All right. Thank you so much, Doctor. We sure appreciate your time. Thanks for checking in with Valley Health Minutes. We'll see you next Monday.